Hi, everyone, and welcome back to Be Well with Dr. Stockwell. I'm Dianna Klein, your podcast host, and today we have the honor of speaking with Dr. Nuzhat Chalisa. She is an endocrinologist and specifically an expert on how the endocrine system affects diabetes and how we can prevent diabetes, how we can treat diabetes. And then she also talks to us about how our endocrine system changes throughout our lives as women. And then to top it all off, she actually told us about a test that can help predict menopause. So, for all of that and a bunch of other interesting information, please listen up to Dr. Nuzhat Chalisa.
Sure. Thank you, Diane, for inviting me.
Absolutely, absolutely. So, Dr. Chalisa, if you would, just tell us just a little bit about yourself. Why did you choose endocrinology and kind of the path that you took to get to the really amazing position that you're in today?
Sure. So, endocrinology always fascinated me. I like the challenging nature of endocrinology, like how different glands in your body work and how it's connected to your brains, different effects of various hormones in your body, how it changes with age. It's just very different from the rest of the system.
Sure, absolutely, absolutely, and it is so different, and, I know myself, I am not as, up to speed knowledge-wise about the endocrine system as I know I should
Sure.
be, and I'm sure our
Hmm.
listeners aren't either. Can you just give us a high level, 6th grade overview, if you
Of
will,
course.
of what the
Yeah.
endocrine system does and how it impacts our lives?
Of course. So, endocrine system is basically composed of various glands in your body, and these glands produce special chemicals, what we call hormones. And hormones are essential for our day-to-day survival. They control like various specialized functions in your body, like growth, metabolism, sleep, fertility, sexual dysfunctions, stress. So sometimes there is like excess or deficiency of these hormones due to a problem in a gland making them. So basically, endocrinologists are doctors who deal with diagnosis and management of these hormone related disorders. Like some of the examples would be, of course, diabetes, we talked about that, menopause, thyroid disorders, adrenal disorders, pituitary, osteoporosis. Those are all sort of kind of managed by the endocrinologists.
Gotcha, gotcha. One that I hear a lot of, several of my girlfriends have either hypo or hyperthyroid
That's
issues.
correct. Right.
And the thyroid is kind of a mysterious little gland to me, but it has such an
Yes.
impact,
Yes.
weight gain and hair loss. Can you talk to us a little bit about that? It seems like a lot of women are suffering from those types of
Sure, of
issues.
course. Thyroid is directly kind of controls your metabolism in the body. So when you have underactive or overactive thyroid, it actually affects almost every organ system in your body. So it's really important to control. It's a very simple gland. It just makes this one hormone, thyroid hormone, but it's really important that the levels of thyroid hormone are maintained at a good level. And if your levels are high, you have what we call hyperthyroidism, and if it's low, we call hypothyroidism, which is much more common overall in the population, and especially in women. And so this becomes even more important when you are pregnant because the levels have to be maintained really strictly in a normal range, or it would result in like it causes IQ problems in the baby and several other problems. So
Wow.
yeah, it's a very like it's a tiny gland, but it does a lot of work in your body.
Right, no doubt, no doubt. And it's interesting you said that most women suffer from hypothyroidism. Just me
Yes.
anecdotally, that's
Mm-hmm.
the majority of my friends, that's the issue they have. And they have
Right.
such a hard time losing weight and that the weight issue typically for
Sure.
them
Yes.
was the one thing that was like, ah, and
Mm-hmm.
tired, being tired and the weight issue. What are
Yes.
what are some other signs and symptoms of both hypothyroidism as well as hyperthyroidism that we can look out for?
Sure. So, like the easy way to understand is like, since thyroid is directly linked with metabolism, when you have hyper or overactive thyroid, everything sort of speeds up. So, like you would, sometimes people will lose weight, you will have what we call palpitations, like your heart starts pounding, and you will be sweaty, and you'll be anxious and jittery, you can have diarrhea. So those kind of things. But like when you have underactive thyroid or hypothyroidism, that's then everything kind of slows down. So you feel like really tired and lethargic, you gain weight, and then you have like you feel cold. A lot of people have cold intolerance with it. you're kind of, you have concentrating difficulty, your brain kind of slows down. Sometimes, if it's severe, in severe cases, you can stop having your periods. So everything kind of slows down with hypothyroidism.
Interesting. Gosh, it's a shame you can't have a hyperthyroid problem to get the weight loss taken
No.
care of without
Yes.
everything else that you described. Oh gosh.
Yeah.
Interesting. And it seems like, especially for hypothyroidism, to get more of those hormones in place, there's a lot of supplements that and medications that these women have to
Yes.
take. Is there synthetic supplementation or non-synthetic? Like, what is the best in
So
your opinion?
basically, we replace it with, so when you have hypothyroidism, your body is, for some reason, is not making enough thyroid hormone, and so it has to be supplemented from outside. So you take the T4, which is the actual hormone. You take T4 replacement, and normally, you just take the replacement. We check your levels. Your levels have to be monitored every so many months, like sometimes 4 to 6. Usually we monitor it either every 4 months or every 6 months, and then we kind of adjust your levels to what's needed. There are several different things that your levels can vary throughout the year, and so that's the reason why it has to be checked and monitored, and then it has to be adjusted based on what your blood levels are.
Gotcha, gotcha. Interesting, interesting. And I know the folks I know that are dealing with this, as soon as they get it all dialed in, life is great. And they
Sure. Yes,
go
of
on as
course.
normal. So it's amazing. It's so nice to know that there is a fix for that. That's fantastic.
Yes.
What
Yes.
about hyperthyroid? How do you guys treat? How is that treated?
And hyperthyroidism is relatively less common than hypothyroidism. And again, everything kind of speeds up, but there are medications that you can use for that too, which sort of blocks. So in hyperthyroidism, thyroid starts making too much. And this could be due to a couple of different reasons, but then you have medications that can block that. So most commonly we use medications, but sometimes these medications are not well tolerated, and or some people develop side effects from it. And so there are some other options too. We can use radioactive iodine treatment, where we sort of give a small dose of radioactive iodine and kind of kill that portion of the thyroid that's making too much. And then we can control it by that way. And then, I mean, in some severe cases, we may have to do surgery, but that's usually not done these days, given that we have all these other options.
Sure, sure. Wow. And that surgery, of course, would include complete removal of the thyroid.
Yes.
Wow.
Yeah.
Okay. Okay. Interesting. So we've talked a lot about hypo, especially with women, and a little bit about hyper as well. When it comes to the entire endocrine system, does it operate differently for women and men? What are the differences, and then what are some of the things that are the same?
Yeah, since it's a lot to do with the hormones, in terms of certain hormones, it's different. Obviously, male reproductive hormones, female reproductive hormones are very much part of it. So, thyroid or adrenal or pituitary, those are some of the glands which operate kind of similarly in men and women. But again, pituitary is like your master gland in your body that controls. It actually controls 6 different hormones, including your reproductive hormones. So in female, it sort of controls your menstrual cycle, whereas in male, and in fertility, whereas in males, it controls obviously testosterone production. And again, fertility in males. So there are some differences, obviously, based off that. But most of the other hormones are sort of similar, function similarly.
Gotcha. Interesting. Interesting. So when it comes to we ladies and our natural life cycle of puberty, adolescence, childbearing age, and then on the decline of all that as
Mhm.
we get older and we hit
Sure.
premenopausal, menopausal, and postmenopausal,
Mhm.
can you kind of describe what our endocrine system is doing at each of those stages?
So early on, obviously, as you in women, as you approach puberty, your menstrual cycle starts. So kind of those hormones play a role when you approach puberty, and at some point you have what we call menarche, or the starting of the menstrual cycle. And then the starting of the menstrual cycle to the ending of the menstrual cycle is what your reproductive age is. Over time, then obviously there'll be a time when your menstrual cycle will be like, you'll have a cycle every 30 days, and over time, after about when you reach 30, your sort of cycle starts going downhill. from that age onwards. And then you're still kind of having regular periods and stuff. You continue to have regular periods until like about few years before your menopause, and that kind of varies from person to person. Sometimes it can, that period perimenopause can last for about 4 to 5 years. For some women it can be more than that. But typically, if menopause occurs before 40 years of age, then we call it premature menopause, because we are not expecting that to happen at that age. Typical age of menopause is about 46 to 51. That's where most women will fall into that category and will have menopause somewhere around that time.
Gotcha. Interesting. Interesting. So, and your endocrine system is doing what, especially during menopause? Like, what is it slowing, kind of slowing things down, or how does that play in?
So yeah, your levels of most of your hormones decrease with aging. There are some hormones which kind of maintain the levels, but most of the hormones decline, and that's kind of physiological, that's normal. So again, like in women, your estrogen levels kind of decline up to a point that when you hit menopause, the levels go quite low, and that's when you stop having your periods. But there's a lot of anxiety associated with perimenopause, especially in women, regarding the onset of menopause. I always get questioned like, how do we know? How is it, like, whether our symptoms, because people get like hot flashes, they tend to gain weight around that time, and they don't know, like, are they really approaching menopause? Is it going to happen within that 1 year? When is it going to happen? And typically, as I said, it can last for about 4 to 5 years. So normally you will start kind of missing 1 or 2 periods per year, and it will keep, you will progressively keep skipping more and more, and it eventually stops, and then you have a year when you will not have a period at all. And there are some tests that can use, and actually currently there's a new test that has come out that can predict menopause within 12 months. So we're
Yeah.
making some progress in that areas to find out. And why we want to know is because there are so many things, like after close to menopause, like when women are in premenopausal stage, you have estrogen kind of is protective for your heart, and is protective for your bones. But when you go into menopause, those levels decline, and that is why most women will have it actually puts women to an increased risk of heart disease and bone loss. And so it's kind of nice to know when you're approaching that period, so you can start taking precautions.
Gotcha. Interesting. So this is the first I've heard of it. It sounds amazing. Predict it within 12 months. Um,
Yes.
how early? Well, how does someone, I guess, go to their treating physician, whether it be an OBGYN or an endocrinologist like yourself, if they go in for a regular or just a well check with their general practitioner, what kind of questions do they need to ask him, or really what kind of test do they need to ask for?
So normally we don't do any testing as such to check for menopause, because the symptoms are quite obvious. So if you fit in like into that age group and you have all the symptoms that you're having, and then you're missing your period, most of the time a testing is not required. But if there is a reason why you want to know, like if you're having an early menopause, or if you're not sure, if you're undergoing you're planning to undergo like some kind of surgery, and if you want to know, then you can discuss it with, most likely I think an endocrinologist would be the best person. So you would discuss what the issue is, and then if needed, like currently the test that we are checking is called FSH, which is a hormone that's produced in the pituitary, and we can check that levels, and the levels sort of are expected to go up as you approach menopause. But currently, you can predict where, at a certain level, where exactly you are, or when exactly you're going to get menopause. Once you are menopausal, then we can tell, like if your levels are really high, we can tell, okay, you are menopausal. But this other test called anti-Mullerian hormone is going to actually just came out, and it's going to predict it in a much give us a much closer window.
Interesting. That is fascinating. That's such reassuring information to know, because I've heard of other stories where women wind up having hysterectomies and so forth when
Sure.
perhaps maybe they weren't necessary, and now
Absolutely.
it sounds like these tests could avoid a lot of that. So
Definitely, it'll be very helpful.
Wow, interesting, interesting. As far as what's involved in the test, a blood test, I take it is
It's a
part of the.
simple blood test, yes.
Okay, okay, interesting. Are you guys able to, as physicians, are you able to get the results back rather quickly, or does it take a while?
It should be back within a few days.
That's amazing.
Yeah.
That's amazing. Wow, wow, that's great news. Great news. Um, As far as keeping as we age, as we ladies age, what are some tips and tricks that you have to help us keep our endocrine system as healthy as possible? Anything that we really should be watching in our diet? Any supplements that we need to make sure we're taking if we are not getting certain things in our diet, or just tips and tricks that you have garnered over the years of practicing medicine?
So yeah, I usually I emphasize a lot on going for routine checkups, and obviously get your yearly annual checkups. Eating a balanced, very balanced diet, staying physically active is like really important, especially for women around menopause, where they tend to gain weight easily. And then get appropriate screening for various cancers, breast cancer, osteoporosis. Since your bone density starts declining after menopause, it's important to take calcium and vitamin D at that point in time. In terms of other supplements, normally like vitamin D, a multivitamin, and a calcium and vitamin D is good enough. Women, you can. There's a lot of other supplements that are available and can be taken. They're not necessary, but with supplements, I also kind of uh, ask people to be careful in what form they're taking, because sometimes if you're taking supplement in the form of like a herbal tea or something, that works pretty good. If you take a natural supplement, that works pretty good. But if you take supplements in the form of pills, sometimes you have to be careful, because there are patients who will have like fatigue is a very non-specific symptom. You can really have fatigue from anything. So if you kind of think, okay, maybe since I have fatigue, my thyroid is off or my adrenal is off, and you start taking the supplement, sometime it becomes actually harmful, because one, these pills can sometimes have fillers that can damage your liver or kidneys. Or if you have like a mild thyroid or adrenal problem, and on top of that you take a wrong supplement, then it can actually be more damaging for you. So you just have to be very
Wow.
careful with those.
Yeah, definitely. Wow. Okay. Very good. Very good to keep in mind for sure. For sure. So, Dr. Chalisa, kind of changing
Sure.
directions here just a little
Sure.
bit,
Hmm.
a little bit away from menopause and aging, kind of talking about diabetes and talking about your research, your extensive research into diabetes and
Sure.
how the endocrine system plays into diabetes. If
Mhm.
any of our listeners go to your LinkedIn page, they're going to see some amazing articles that you've written
Yes.
and just incredible wealth of knowledge. Can you? We all have heard of diabetes, and we all know it's a plague, unfortunately, of a disease for sure. Something that sometimes is avoidable for some, and sometimes is not for others. Do
Sure.
you mind kind of elaborating a little bit on how the endocrine system plays into diabetes, not just for women but for everybody?
So diabetes, obviously, is almost kind of. It's also kind of becoming like a pandemic. All over the world, the numbers are keep going up, and it's kind of equally common in men and women. And the way it's related. So again, since diabetes occurs because of a problem with insulin. So basically your body has a gland called pancreas, and the pancreas it makes a hormone called insulin. And there are two different kinds of diabetes. There are the type 1 diabetes, which is sort of more of an autoimmune mediated diabetes and occurs in children, or at least starts in children. Is a problem where your pancreas doesn't make enough insulin. At some point, there are cells called autoantibodies. This is like your body's own cells which goes and destroys your pancreas, and so it stops making insulin at all. And so these kids have to go on insulin as soon as they're diagnosed. So that's like the type 1 diabetes. The type 2 diabetes is slightly different. Type 2 diabetes, basically, your body is making insulin, but the insulin that you're making is not good quality. So it's not doing its job. So normally what insulin does is, normally when you eat, your glucose that you take in your diet, it goes into your circulation, and from the circulation it's taken to the tissues. And for the glucose to enter into your cells to be used as energy, you need insulin. So insulin is like a key that opens that door for the glucose to enter. But when you have type 2 diabetes, your insulin is not good quality, so it doesn't do that job. As a result of which, the glucose kind of stays outside the cells into your blood, and that's how you get like high blood glucose. And long term, if your glucose continues to stay high in your blood vessels, then it starts causing vessel damage, and then that leads to various complications of diabetes.
Wow, interesting. That's fascinating. I have never heard of type 1 diabetes being described, or type 2 diabetes, excuse me,
Sure.
being
Yeah.
described as just poor quality insulin. That it makes
Yes.
sense. I always, in my layperson's brain, thought,
Hmm.
okay, their pancreas quit
It's a
producing
deficiency.
insulin.
Yeah.
Right, but it's actually just the quality. Fascinating. Okay. Okay. Interesting. Um, as far as diabetes goes, and its interaction with the pancreas, which is part of the endocrine system, like what aside from a healthy diet, it seems like that's the advice that I get is, oh, just eat healthy and don't eat a lot of sugar. That's what we
Hmm.
hear to help prevent diabetes. Is it sounds
Yeah.
like it's much more than that. Could you elaborate as far as what we can
Sure.
do to avoid
Of
diabetes
course.
all through
Of
life?
course, because diabetes can be genetic, but actually a combination of genetic and environmental factors that are responsible for diabetes. So obviously, obesity and weight gain has a lot to do with it. It significantly increases your risk of developing diabetes. And so, in terms of management, obviously, nowadays, if you watch, even if it's genetic, and even if you have a family history, if you would watch your diet and if you would watch your weight, it is preventable. Or even if you're not able to prevent it, you can delay diabetes by as much as 10 years just by watching your diet and maintaining your weight.
Wow.
So, and sometimes, you go into your blood glucose levels are high enough where it's not diabetes, but it's like what we used to call borderline diabetes. We call it pre-diabetes now, which means it's not diabetes, but it's about kind of not normal too. It's kind of in between. And that's like your window of opportunity. When we diagnose people with pre-diabetes, then at that stage, if you bring about changes in your lifestyle and your diet, you can actually keep yourself in that range, or even reverse. You can even go back and get back to like normal glucose at that stage. Or you can delay from going into diabetic stage for a long, long time. So that's where like your routine health maintenance, seeing your physician, your annual visits come into play. Because if you do that every year, then you would find that you would know if you're in pre-diabetic stage, and you would start taking care of yourself early on.
Interesting. Yeah, definitely, definitely. Now, for someone, let's say that they have gone past the pre-diabetic phase and they're a
Hmm.
full-blown type 2 diabetic, but yet they change their diet, they exercise more. Is there a way to go back? Is there a way to undo the damage and become no longer a diabetic after you've been fully diagnosed as a type 2 diabetic?
Yes, absolutely. So diabetes, we said it cannot be cured, but it can definitely be controlled to a point where your sugars are completely normal. And as long as your glucose is in normal range, whether you have to do diet or an exercise, whether you have to add some medications, even if you use medications, with the help of the medications, if you're able to bring your numbers down to almost normal levels, then your body is as good as any normal person. Then you won't develop the complications. So it is really important to keep those glucose levels down. And sometimes when you have full blown diabetes, you have to use diet, and obviously physical activity helps. And top of that, you there is so many options in terms of what medications are available today, compared to what we had 10, 15 years back. There's many medications that not only help in controlling your glucose numbers, but there are medications that help you protect your kidneys and protect your heart, And so they can be used, one or combination of these medications can be used along with diet and exercise to keep it in good shape.
Amazing. Awesome. That's great. That's great news. And one thing I've always wondered, the high glucose levels in the blood, I'm sure, is why people who are type 2 diabetics eventually, unfortunately, lose their sight or start having, I think neuropathy is the correct term, in their
That's
fingertips
correct.
and toes, and ultimately, unfortunately, leading to some amputations in some cases. Is that because solely because there's an advanced or a higher level of glucose in the blood? Or are there other reasons for that? What element of diabetes causes that to
Yes.
happen?
So what happens is when you have persistently high glucose in your circulation, in your blood vessels eventually starts getting damaged. And so you can have two different kinds. You can have macrovascular damage and microvascular damage. So what that means is macrovascular is your larger blood vessels. For example, blood vessels going to your heart and vessels going to your brain. So when these blood vessels get damaged, then you get your arteries kind of narrow in a similar way of what happens when you have a heart attack. And because of decreased blood flow to these organs, then you end up having heart attack or you end up having a stroke. And that's why diabetics are at a higher risk of having a heart attack and stroke. Similarly, when the blood vessels that are supplying, like the smaller blood vessels, they are also blocked in the similar fashion. And when these are blocked, then your arteries supplying to your nerves get damaged, causing what we call neuropathy. Or if your arteries supplying to the eyes are damaged, then people can become blind from diabetes. Or if your arteries supplying to your feet are damaged, then you can develop gangrene and people end up getting amputation because of that.
Oh, gosh, interesting. Okay. Okay. Wow. So much great information. So much great
Sure, thank
information for
you.
not only ladies, but for the gentlemen in our lives as well.
Of
Thank
course.
you. That's really great. Before I let you go, I am absolutely fascinated by the Kisat Diabetes Organization. Do you mind telling us
Sure.
about that? It's what you founded. It sounds like it is just very near and dear to your heart. Um,
Yes.
could you tell us about it?
So, Kisat Diabetes, I was formed in 2013 after my father passed away. I had formed it in the memory of my father. He passed away from complications of diabetes. And after he passed away, I was very close to him, and it was very hard for me to see my father, passing away. He was about to get amputation, and he even passed away even before he could get it.
Mm.
And it was very hard for me to kind of overcome that feeling that, me being a diabetes specialist, I couldn't do much about it. And so I think after a year, I sort of founded this organization with the mission of. So I was thinking, what should I do that I can sort of overcome that feeling, and maybe something good to prevent this from happening in others. So that's when I decided to form this organization, and with the mission of kind of creating awareness and preventing diabetes and its complications. And our goal is to do early screening and provide education, so we can prevent this from happening.
Wow, excellent, excellent. Oh, well, I'm sorry about your father. Oh, that had to be tough. That
Yeah,
had to be tough, and
that was, yeah.
what an amazing thing to do in his memory. I'm sure he's extremely, extremely proud. That's amazing. That's amazing. Well, one last thing,
Sure.
if for our listeners, if they are in the Chicago area or if they want
Hmm.
to travel to come and be seen by you and
Sure.
receive all this amazing information personalized to them, how can they find you? Do you have a website and or any kind of social media handles that we can share?
Yes, of course. My information can be found on my Kisat Diabetes organization website. It is called kisatdiabetes.org. I'm also in my practice. I'm working in Shanahan, Illinois, which is a suburb in Chicago. And I'm affiliated with Morris Hospital, so I can be found in the Morris Hospital website too. And I would also like to announce about my book here, which is about to be published in fall of this year. And this book is actually a comprehensive guide on management of diabetes. It will include everything one needs to know about diabetes, understanding diabetes to medications to diet, everything. So that would be a useful tool in patients who are diabetes, or if you're taking care of a loved one who has diabetes, or even if you're pre-diabetes.
That's amazing. And what is the title of your book?
It'll be called named as Diabetes Beyond Numbers.
Awesome. Diabetes Beyond Numbers. Okay. And will it be sold via your personal website or via Amazon
It will be
or is
sold via Amazon.
Amazon? Excellent. Okay. Well, I will definitely order that book. That sounds
Absolutely.
fantastic. And I'm sure a lot of our
Great.
listeners will as well.
Sure.
Um, so awesome, Dr. Nuzhat Chalisa. Thank you so much for your time. Really
Thank you. My
appreciate it.
pleasure.
This is such great information, and we wish you good health, and especially during this interesting time that we found ourselves in. Please stay safe and stay healthy, and thank you again for your time.
Sure. Thank you. Stay safe.